This is COVID-1, the first of 4 public hospital wards at the heart of the Albanian government's pandemic response. From November to February, it was overrun because of a government policy to concentrate all the country's COVID-19 cases in Tirana.
At the very beginning, we were thinking it's a good idea, but with the time, when the time ran by, we were thinking it's much easier, and economically and psychologically and medically thinking, to get those services much closer to that people.
By then, word had got around that hospitals were under pressure. ERJON SKENDAJ, named Journalist of the Year for his coverage of the pandemic, witnessed the problems.
Patients had to wait 6 to 8 hours just to be unloaded from ambulances because there were no beds available. They were very sick and needed to go to intensive care immediately. Some died in the ambulance.
In the overcrowded and understaffed wards, some patients committed suicide by jumping from the windows. Hearing these stories, many patients were afraid to go. Some went to private clinics, many of them to Turkey through a special charter flight. And many stayed home. Yorgi Pochi says he spent $5,000 on oxygen and nursing.
I had many friends who went to hospital and never got out alive, so I decided to stay home. At first it was easy. I thought, is this the great COVID everyone is talking about? But then I got really sick. I thought I died and came back to life.
Prime Minister Rama says Albania's early lockdown initially saved the country from the soaring infection rates of Western Europe.
What happened in Italy scared us a lot. So it was a bit like a running home. And we were, if I recall well, the first country after Italy to impose lockdown. Our lockdown was very, very heavy. Then we did many things faster than others because of the terrible fear that if we would not control it, this could be a disaster.
But Albania didn't have the resources to keep workers at home during the second wave of the virus. Herd immunity was achieved through infection at a high cost. Officially, 2,500 people died of COVID-19 in Albania. But the US-based Institute for Health Metrics and Evaluation estimates the figure at nearly 16,000, because that's how many more people died here over the past 9 months than would normally have died in the same time period. With herd immunity achieved, infection rates plummeted in time for a general election in April. And 17% of the population has now received at least one vaccine shot, far above the global average of 12%, helping Prime Minister Rama win a third term. Psaropoulos, Al Jazeera, Tirana.